this is the upper region. Upper boundary is the roof. The lower boundary is the floor. Lower boundary floor. Floor is consisted by the skin and the connective tissue. Then for wall, the medial wall is composed by the upper four ribs and the related or correlated muscles. The lateral wall is consisted by the humerus and corresponding muscles, and the anterior wall is composed by the pectoralis major, pectoralis minor muscles, and the posterior wall composed by the subscapularis muscles. So this for the general. You can see from here we use different view. This just similar as that one. For here, if we cut, we make a transverse section, then we observe from upward to the lower, we can find this is a medial wall. This is a medial wall. This is the anterior wall. Anterior wall major composed by pectoralis major, pectoralis minor, and the deep fascia. Okay. The posterior wall major composed by the scapular bone and the subscapularis muscle. This, and the lateral wall composed by the humerus bone and the corresponding the muscles. So corresponding muscles, and then from here we just see these four walls: anterior wall, posterior wall, medial wall, and the lateral wall. And if we cut from this one, this is a sagittal section. Sagittal section, we can see clearly the anterior wall, posterior wall, and the contents of the axillary fossa. Okay. Then one by one, we just, for example, the upper part, because the upper boundary is smaller, we can also name as apex or roof, the apex or roof. So middle one point of clavicle, superior margin of the scapula, and the lateral border of the first costal rib. So this, the base is the skin. The anterior wall, again, pectoralis major, pectoralis minor, and also clavicle pectoral fascia, and here subclavius muscle. This small muscle also contributed this fossa. Okay. Posterior wall. So this is a scapular bone. Again, scapular bone, the spine of the scapula. So subscapularis muscle and subscapularis muscle, and latissimus dorsi and teres major muscle. Also here, teres minor just contribute to the posterior wall, thickness of posterior wall. Okay. So here I show you the posterior wall. And then here I show you the medial wall. Medial wall, the upper four ribs and the corresponding muscle from the lateral or from superficial to deep, we can find out the serratus anterior muscle, intercostalis externus, and the intercostalis interni muscles. Okay. Lateral wall. Here there is one groove. This groove for the insertion of pectoralis major, latissimus dorsi, etc. This muscle. So the lateral wall, biceps brachii go down, and then coracoid brachialis. You know, coracoid brachialis and biceps brachii also they origin from here and then inserted to the cubital region. Okay, and intertubercle. This is a greater tubercle. This is a lesser tubercle. There is one groove for the insertion of pectoralis major muscle. This groove we call the intertubercular groove. Okay. Here just show you part of the contents of axillary fossa. Contents of the axillary fossa. Here you can find the yellow color brachial plexus nerve, the nerve. Red color, the axillary artery and its branches. The blue color, axillary vein and its tributaries. And also green color, axillary lymph nodes. Besides this, also contain some loose connective tissue. Okay, so we briefly review this structure. Or we also have spent quite a lot of time for these structures or in our systematic anatomy. But I think maybe most of you have forgotten this structure. So here we review this. Brachial plexus. So if I give you the term explanation, first where it is located, then which nerves form the brachial plexus, and then the major branches and the distribution of this brachial plexus. So if I give you this term, you can explain brachial plexus is composed, just a formation, composed by the ventral ramus or anterior ramus of C1 to C8 and part of the anterior ramus of T1. So it is formed by this, and then it is located or passes through here. There is one muscular space we call the scalenus fissure. The features of it is, first, these roots join together, form into upper, middle, and inferior three trunks, upper, middle, and inferior three trunks. And then these trunks, each trunk can be further divided into anterior division, posterior division. Okay, and after that, the anterior division of the upper trunk and the middle trunk join together, form into the lateral cord. And the three divisions of these three trunks, posterior division of these three trunks, form into posterior cord. And then the anterior division of the inferior trunk form the medial cord. Then most of the branches are given by the lateral, medial, and posterior cord. So these are the give you the term explanation. First, the formation. It is formed by anterior rami of the spinal nerve of C5 to C8 and part of T1, and located within this region. This region, this is the scalenus anterior, scalenus middle, form into the scalenus fissure. So pass through here and then enter axillary fossa. Axillary fossa. And the features, it is the most complicated plexus of our body. So first form into 3 superior, middle, inferior trunks, and then each trunk divides into anterior division and posterior division. And after that, the divisions reunite into 3 cords, and most of the branches are given by these 3 cords. Okay, these are the brachial plexus. So position passes through the scaling fissure. Okay, branch, major branch. There are 5 major branches you must remember. Okay, if the branch given from above, this is the scapular bone. Above the scapula, we call the suprascapular branches. Suprascapular branches, most of them are smaller, quite small one. Infrascapular branches, quite large. Okay, here we ask you to know this. For example, suprascapular part, suprascapular, supraclavicle. This is the clavicle bone. Here there is one. From here, just the roots of a supraclavicular part. Given this one, follow my mouse. Okay, follow this. This one travel along the anterior surface or superficial surface of the serratus anterior muscle. This is a long thoracic nerve. Long thoracic nerve. I mark as a star from here. This nerve, you need to pay attention to it, because if there is any cancer within the mammary gland, sometimes we need to clean the lymph nodes within this region and easily damage this nerve. But if this nerve is damaged, the serratus anterior will get paralyzed, and then the wing-like shoulder will appear. Okay, this is one. And also some others, we just know this. Okay. So long thoracic nerve is quite important. And the other main branches from this part, you know, these 3 cords just below the clavicle bone, we call the infrascapular clavicular part. We ask you to know the one is the branches, you know, it is contributed by the lateral cord and the medial cord of the brachial plexus is the median nerve. This nerve is very important. We need to know. And then the other one, this one, given by the lateral cord and supply the anterior groove muscle of the arm, we call muscular cutaneous nerve. And the medial cord give another major branches. This branch is the ulnar nerve. And then for the posterior cord, given the axillary nerve and radial nerve. So we ask you, you know, muscular cutaneous nerve, median nerve, ulnar nerve, radial nerve, and axillary nerve. This nerve is the thoracodorsal nerve. So these are very important. We ask you to remember. Okay, here show you, you know, the lateral cord given muscular cutaneous, and both the lateral and the medial cord contribute the median nerve. Okay, another one, medial cord give this large one is the ulnar nerve. Okay, the posterior cord give the posterior cord gives the axillary nerve and the radial nerve. Axillary nerve and the radial nerve from here, we cannot see clearly. We will see a little minutes later. Okay, here, axillary nerve. Axillary nerve passes through one space. This space we call the quadrilateral space. It is formed laterally by the neck of humerus, superiorly by the pectoralis major, inferiorly by the pectoralis minor, and medially is long head of triceps brachii. So this small region is quadrilateral space. The posterior circumflex artery of the humerus axillary nerve passes through this space. So this is the axillary nerve. The major part go downward, passes through the radial groove for radial nerve is the radial nerve. Okay. And the third one, supply the latissimus dorsi is the thoracodorsal nerve. Okay. Here, maybe you're familiar with this. If in this position, and if in this position, easy damage the part, the part of the brachial plexus above the clavicle region, we call supraclavicular part, the superior part. But if in this way, easy damage the lower part of the brachial plexus. Okay. Here, another one, the artery, cardiovascular part of this region. Artery is axillary artery and brachial artery, especially axillary artery. So axillary artery starts from where? Starts from the lateral margin of first costal rib and terminated at the inferior margin of teres major. Okay, this part, these two dark color highlighted the whole length of our axillary artery. Axillary artery can be divided into 3 segments by this muscle. This muscle we call the pectoralis minor. Okay, called the pectoralis minor. For here, pectoralis minor cover this part is the middle part of this region. Okay, above is the first segment, below is the third segment. So axillary artery can give the branches from this 3 parts. First part gives 1 branch from here. We call the lateral or superior thoracic artery. Superior thoracic artery supplies the first costal rib and the second costal rib here. So the first segment. The second segment, just along or above this margin, pectoralis minor gives off. 1 is artery, number 2 indicated. We call the thoracoacromial artery. Thoracoacromial artery. Thoracoacromial artery gives 1 branch to supply pectoralis minor, another branch to supply the scapular region, the muscle. And then just below margin gives off the lateral long thoracic artery. Lateral thoracic artery. So this is the second part. The third part gives off what? Gives off the anterior and posterior circumflex artery of humerus and subscapular artery. Subscapular scapular artery further divided into the circumflex artery of scapula, passes through the trilateral space, and then thoracodorsal artery supply our latissimus dorsi here, this one. Okay, so we can judge the branches of axillary artery by the brachial plexus. So first, this is the pectoralis minor. So the first segment gives off this branch. This branch we call the superior thoracic. We use this one or this one. We use this one. So first segment gives off one branch we call the superior thoracic artery. The second branch, a second segment covered by the pectoralis minor, just at the point above, superior margin of the pectoralis minor gives off this one, thoracoacromial artery. Thoracoacromial artery further gives branch supply the scapular region, the acromion region, and the pectoralis minor and major. And just near the lower margin of pectoralis minor gives off the second. This is the lateral pectoral artery, or lateral thoracic artery. Third part of axillary artery gives off one big is subscapular artery. Subscapular artery further divided into the circumflex artery of the scapula, passes through the trilateral space, and then the thoracodorsal artery supply or muscle latissimus dorsi. Another two branch is anterior circumflex artery of humerus and the posterior circumflex artery of humerus. Okay, so this is the third segment. Okay, here indicates the margin of the teres major. Below will be brachial artery. Okay, the axillary vein just accompany the axillary artery. It receives the cephalic vein, brachial axillary vein. Okay. Another star marks the axillary lymph nodes. Why do we mention? Here, axillary lymph nodes drain the lymph from, most part of the mammary gland, and the anterior wall of the thoracoabdominal region above the belly button, and the posterior wall thoracoabdominal region above the belly button, the posterior region. So axillary lymph nodes, we still need to review this. Okay, we can find, axillary lymph nodes can be divided into 5 groups. One group, for example, travel or align along this pectoralis major, pectoralis minor. We call the pectoral group. This is the anterior group. Anterior group drain about 70% of lymph nodes of the mammary gland. Okay, and the part align along the subscapular artery and vein. This group, is along the anterior margin of the latissimus dorsi. This we call the subscapular group, the posterior group. And this group align along the axillary vein. This is the lateral group. The lateral group collect the lymph of the upper limb, and the posterior group collects the lymph of the posterior wall, abdominal wall. Okay, this collects the lymph of the anterior cervical abdominal wall. These three groups, this is the posterior group, anterior group, and lateral group, all drain into here. Central group, the central group, and the central group drain to here, this apical group. Therefore, the grouping or groups of axillary lymph nodes are very important. Here, again, lateral group, posterior group, anterior group drain into the central group. Central group drain into the apical group. The apical group and then drain into the subclavian trunk. Okay, here I can give you one case. You know, here show you the breast cancer. For the later, you know, the advanced stage of breast cancer can be, the cancer cells can be transferred to other region of the body. In this way, we call the metastasis. And the metastasis can be spread through both the blood vessels and the lymphatic vessels. Okay. Here, show you the lymphatic metastasis of breast cancer. So, lateral part to axillary lymph nodes, you know, here, lateral part, some directly to the apical lymph nodes. And medial part can transfer to the peristernal lymph nodes. And the lower part can be transferred to the mediastinal bronchial lymph trunk. Okay, here give you the clinical case, indicates the axillary lymph nodes because the, you know, the mammary gland, the mammary cancer can transfer through this lymph nodes. So if you are a doctor, you want to completely remove or clean all the tumor cells, you need to remove the lymph nodes of axillary region. In this way, very easy to damage the structure, you know, of this region. Okay, so the lung thoracic nerve can be damaged and appear these symptoms for the patient. Okay. Here also show you, you know, the the breast cancer can be transferred to the lungs through the lymph nodes or blood vessels. Okay. Another concept here, axillary sheath. What's the axillary sheath? We know the axillary lymph nodes, axillary artery, axillary vein, and also the brachial plexus nerve, all enclosed by the connective tissue of axillary region. So this connective tissue we call the axillary sheath. Axillary sheath. Okay, this is the key point for the axillary region. Meilin, are you here? Meilin, can you hear me? No. Oli.
Yes, 老师.
Yeah. Oh, Meilin. Can you understand what we have talked about the axillary region?
Yes, 老师.
Okay. So can you,
Thank you.
Briefly describe the key point for the axillary region?
The extension of the deep cervical fascia
Yes,
that forms the tubular sheath that surrounds the axillary artery
yes.
and vein
Okay, okay,
and the brachial plexus.
okay. Very good. Okay,
Thank you.
you're welcome. And so the key point, axillary region, the boundary of axillary fossa, the contents of axillary fossa, and then the concept of axillary sheath. So for the boundary and the contents, especially artery, nerve, and lymph nodes are very important key points for this part. Okay. So the deltoid region and the scapular region. Deltoid region refers the region covered by deltoid muscle corresponding to here. And the scapular region refers this region just the corresponding to the scapular bone. Okay, so here we just briefly review the muscles. Trapezius muscle inserted to here, the spine of scapula. Okay, when we strip of the trapezius muscle, we can find out levator scapulae, deltoid muscle, levator scapulae, and supraspinatus, infraspinatus, and teres minor, teres major. Anteriorly is the subscapularis muscle. These muscles are located in the deltoid region and the scapular regions. Okay, scapular regions. Here, show you the muscle attachment and innervation, and also the action. Deltoid region, within the superficial fascia, we can find out the cutaneous nerve. This cutaneous nerve, the superior part, comes from the supraclavicular nerve, and this part for the anterior region. Okay, see layer structure. Anterior region here supplied by the axillary nerve, and also some branches, cutaneous branches from the radial nerve, muscular cutaneous nerve. Okay, there is one reginal space for here. Oh. Reginal space, delta pectoral triangle. What's the delta pectoral triangle? In fact, it is just narrow space, a groove. You know, delta margin by deltoid, pectoralis major, and another patch of clavicle bone. From this region, the superficial vein, upper limb, we call the cephalic vein, penetrate this region and then drain into the axillary vein. So this is the delta pectoral region. Okay. And for the scapular region, this muscle we just mentioned before, there are two triangle area, and also these muscles form one we call the rotator cuff. So here we need to know three terms. One thing, these muscles, okay, form two triangle, teres minor, teres major, long head of triceps brachii, and the surgical neck of humerus form this quadrilateral space. Okay, axillary nerve and posterior humeral circular artery passes through. Okay, and the medial part, the teres minor, teres major, long head of triceps brachii form another trilateral space. Trilateral space, this is the circumflex artery of scapula passes through. And the lower margin here, our radial artery and deep brachial artery, radial nerve and deep brachial artery passes through this region, go to the posterior region of the arm. Okay. So here, briefly review the shoulder joint. The shoulder joint is formed by humerus, head of humerus and clavicle scapular bone. Okay, and also above is a acromion and a coracoid. So forms here, there is one arch. This arch we call the acromion coracoid arch. Another myotendinous rotation cuff. Okay. These two terms. What is coracoid acromial ligament? The here, coracoid process acromion. So this we call the coracoid acromial ligament. Okay, and the tendons of supraspinatus, infraspinatus, and teres minor, and also the subscapularis muscle form the myotendinous rotation. Okay, again, repeat once. Teres minor, infraspinatus, supraspinatus, and subscapularis form the myotendinous or rotator cuff. Okay, so the rotator cuff is very important. You know, some patients, especially near my age, around 50 years old, okay, sometimes they feel very painful for the shoulder region, even cannot move the upper limb. Most often is something wrong with this myotendinous cuff, rotator cuff, okay. So here, again, show you the rotator cuff. Okay. Here, show you the quadrangular and triangular space. I already mentioned, we pass through quickly. Okay, so here, again, you know where it is located. The boundary shows the location and the contents shows the significance. Okay. Again, here, the real sample, if we do the dissection, the real sample is like this. Quadrilateral space is located here. Okay. Real sample is located here. Okay. Here, show you. For the scapular region, you know, most the blood vessels can connect with each other. In this way, we call the anastomosis. Anastomosis, okay. Anastomosis. We just know this enough. Again, show you the blood vessels of here. Okay. For the arm region, the superficial structure, you know, we ask you to master these three nerves, both arm and forearm. We just describe together, okay? So the superficial vein, three vein, repeat again. This is the dorsal venous arch of the hand. From the lateral part, the capillary, you know, capillaries unite into small vein, we call the venous, and the venous unite into cephalic vein. Cephalic vein train along this and then to the deltoid pectoral triangle and drain into the axillary vein. And in the medial part, ulnar side, unite into the basilic vein. The basilic vein drain into the axillary vein at about the junction between the superior one-third and middle one-third from here, and then unite together with the brachial vein into the axillary vein. And the vein just connect between with them is the median cubital vein. Median cubital vein is a site often used for the blood sampling. Okay, so this is a superficial veins. We here just repeat again, just show you this structure. Basilic vein, okay. Median cubital vein. Deep structure. Superficial fascia will also belong to the superficial structure. Okay, deep structure can divide, include 4 muscles for the arm region. The anterior region, still remember? Anterior region, BBC muscle. Biceps brachii. Biceps has 2 heads. One long head passes through the shoulder joint. Short head connect with the coracoid process and the insertion to the cubital fossa. Okay. Biceps brachii. Coracoid brachialis. Okay. Coracoid brachialis. A region from the coracoid process and inserted to the middle part of the humerus, and then brachialis, a region from middle point of the humerus and inserted to the humerus. Okay, BBC muscle. These 3 muscles supplied by here, deep brachial artery. Brachial artery has 1 branch, the deep brachial artery, and then the supraulnar collateral artery, okay, and radial collateral artery, okay. Deep veins, usually for the upper limb, deep veins, the brachial vein unite with basilic vein into axillary vein, and the axillary vein receive the cephalic vein, okay, and then drain into the subclavian vein at the lateral border of the first costal rib. Okay, the nerves, again, this nerve. BBC muscle supplied by muscular cutaneous nerve. Okay, so here again show you muscular cutaneous nerve. Muscular cutaneous nerve is given by the lateral cord of brachial plexus and supply these 3 muscles. After that, travel into the lateral part of antebrachial region. Okay, BBC. So posterior region of the arm, here, the cutaneous nerve from the axillary nerve and radial nerve, and the muscle is triceps brachii. Triceps brachii. The triceps brachii supplied by radial nerve. Okay, the blood supply to the skin. Here, show you. Superficial, again, just repeat that. Deep structure, here, just 1 muscle. Triceps brachii, the long head, the lateral head, and the medial head. Okay, between the long head, lateral head, medial head, deep to this, there is 1 groove. This forms the tunnel we call the humeral muscular tunnel. This one is the most important part. Okay. Here, show you this part, most important part. Here, show you, you can see in the posterior surface of humerus, there is one groove. This groove for radial nerve, and then covered by medial and lateral head of the triceps brachii, and then form one tunnel. Between or within this tunnel, the radial nerve and deep brachial artery and veins pass through. So here, there is one term, humeral muscular tunnel. Humeral muscular tunnel. Here, show you origin insertion of triceps brachii. Again, okay, I already mentioned humeral muscular tunnel. Humeral muscular tunnel from here. So where it is located? It is located in the posterior region of the arm, and then structure passes through radial nerve, deep brachial artery, and veins. Here, again, clinically, the humerus bone easy to get broken. If the broken, easy to damage the radial nerve. Okay, easy to damage the radial nerve. Here, I give you clinical case for here. Okay. Here, I show you the clinical case. Here. One patient, after get one fall and get the broken of this bone, the bone broken easily damages this nerve. So if like this, the radial nerve easily damaged. If the radial nerve get damaged, the patient maybe get wrist drop. Okay, according to time, I will leave some for next time. And Shan,
yes, Laoshi.
can you understand what I have mentioned about this part?
Yes, Laoshi.
Okay.
There is a wrist drop when the radial artery is just damages.
Okay. Okay, we make summary for this part. The key point for the arm part, anterior region, you know, the superficial structure includes 3 veins pass through, okay, 3 veins. And then for the deep structure, there are 3 muscles, BBC muscle. These 3 muscles supplied by brachii artery and also muscular cutaneous nerve, and the posterior region as triceps brachii. Triceps brachii and the bone of humerus form one tunnel, humeral muscular tunnel. The radial nerve, deep brachial artery, and vein pass through. If there is bone fracture from this region, easy to damage this part. Okay, and then the remnants we will continue for next time. Okay, today we will stop here. See you next week.
Okay, Laoshi.